Hi everybody and welcome back to Miss Angler's biology class. I am Miss Angler. In today's video, we are going to be looking at the effect and management of diseases. Now this video does follow on from my introduction to the microorganisms, where we cover what a virus, bacteria, fungi, and so on is, and we look at their characteristics. So I suggest you go and watch that video first before you watch this one. And if you are new here, don't forget to give this video a thumbs up and make sure you are subscribed with your notifications turned on, because I post every Tuesday and Thursday. And if you are in grade 11 and you're looking for that distinction in your exam and in your final mark, then you should think about getting my study guide, which is available on my website. It is beautifully illustrated. It is filled with summaries and easy to understand explanations, as well as telling you how exactly to answer the questions to get full marks. So let's jump straight into the video, and I quite like this little diagram here to sort of explain what we're going to be doing here. And with each one of the diseases that we're going to cover, we are going to be looking into who is the host of the disease. In other words, where does this disease grow and live the majority of its life? We're going to look at the pathogen itself. So what kind is it, and what are some of these signs and symptoms that you have this disease? And then finally, what is their favorable environment? So where they actually exist. Now, this little triangle is what we call an infections pyramid, and it helps us explain how to manage diseases and how to look into the best course of treatment for them. Now let's move into our first of the pathogens. We're going to look at a virus pathogen called HIV, or human immunovirus. Now for each one of these infections, we are going to run through the infection pyramid, which means that we're always going to discuss the host, the pathogen, and its environment. So for HIV, the host is humans, specifically our CD4 cells, which are the white blood cells that are supposed to be responsible in preventing the infection in the first place. The pathogen itself is called HIV, and the environment that we find it in is bodily fluids. And this is things like blood, semen, and breast milk. Now, if HIV is allowed to replicate as much as it likes, it can lead to AIDS. AIDS stands for autoimmune deficiency syndrome, which basically is a time at which your immune system has failed and decreased so much that you can't actually fight off anything. And that is where opportunistic infections come in, and they attack your body, and often they lead to your death. So it's something like flu could cause your death if you have HIV. Now, where it replicates specifically is the immune cells that are supposed to be responsible for controlling viral infections, which makes this quite difficult to treat. Now, if you're not so certain about how HIV actually replicates, you should go and watch my video above that I've linked on the lactic and lysogenic cycle. That is how viruses replicate, as well as specifically HIV replicates. Then we're going to move on to the signs and symptoms of HIV. Now, generally when you get HIV for the first time, you are going to experience a flu-like symptom, and that's going to be like fever, body ache, headaches, things like that. It's actually quite difficult to tell if you're getting sick or not, and you need to go get an HIV test. Now, certain people fall into one of three categories. When you contract HIV, the progression can be very rapid, intermediate, or very slow. And when I say rapid, that can be over a few weeks. Intermediate can be months to 1 year, and then slow can be up to 1 year to 5 years before you actually progress any further in the disease. So it really depends on also the individual. Now, when it comes to actually contracting HIV and treating HIV, you can contract HIV a number of ways, but the most common ways are through sexual intercourse that is unprotected, with no condom, no barrier protection. You can also get it through blood and organ transplants. And when you have HIV, the best way to prevent passing it on, but also not contracting and further developing AIDS, is to take ARVs, or antiretroviral medication. And what they do is they slow down the growth of the virus. Now, the next pathogen we're going to move into is a bacterial one, and it is tuberculosis. Now, if you don't know very much about how bacteria reproduce and how it functions within tuberculosis, I suggest you go and watch the video above that I've linked on how bacteria reproduce. Now, again, we're going to look at the 3 key factors of our infection pyramid, starting off with the host. The host is a human, specifically our lung tissue. The pathogen is called Mycobacterium tuberculosis. That's its scientific name. And the environment that we find it in is the air or the mucus within our lungs. And often we actually cough it out onto other people. And TB likes warm, damp conditions. So your lungs are the perfect place for them to grow. Now, when it comes to signs and symptoms, the first main thing that you can see is inflammation of your respiratory system. So your lungs become swollen, inflamed, and they lead to lesions. A lesion is a sore, and it oozes blood slowly. And TB can also move into your brain and your bones, which is quite serious and terminal if left untreated. And all of this inflammation in your respiratory system can lead to you coughing up blood, which is a very, very common symptom and a very clear indication that you potentially have TB. Other things which make sense is chest pains, because obviously your lung and lung tissue is swollen, weight loss because of your loss of appetite and not feeling good, and also, of course, fever, because that's associated with inflammation. Now, when it comes to how do you contract and treat this disease, well, that is generally linked to via sputum. Now, sputum is basically mucus that you've coughed up from your lungs, because remember, that's what's going to happen when you have TB. You need to cough all the time, and you cough on your hand, or you cough in front of you, but you don't block or wear a mask or cover it with your hand. And so what happens is it aerizes and aerates in front of you, and it can land on somebody else, and they can breathe it in, they can get it on their hands, they touch their mouth, their nose, and then they get TB. And TB is actually quite opportunistic. So often if you have HIV, you run a high risk of also contracting TB. Now, to treat TB, you use something called DOTS antibiotic, which is directly observable treatment system, which basically means you take a month course of antibiotics, and you take it every single day for 6 months, and you must complete the course. Otherwise, you run the risk of creating antibiotic resistant bacteria, which is not what we want. Most people actually feel very good after the first couple of weeks of using their antibiotics, so they stop taking it. But it's really important for you to complete the course to kill the TB completely. Now let's go into the third pathogen, which is going to be caused by a protist, and that is malaria. Now, if you don't know very much about protists and how they move and how they may be swimming through water, which is where we find them mostly, you should click the video above now and watch that before continuing. So let's go into our 3 pathogen links, and that's going to be it again. Who is the host? Humans. And most importantly, there's another host, which is female Anopheles mosquitoes. It must say female when you answer in an exam, because males don't carry the malaria. And Anopheles refers to the type of mosquito that this occurs to. Now, the pathogen that causes disease is a plasmodium, and we find it in stagnant water, which is water that is sitting still, but we also find it in the liver and red blood cells of mammals, and we also find it in the salivary glands of that same mosquito. Now, in terms of signs and symptoms, malaria is often misdiagnosed in the very beginning because it just feels like the flu. And you can see that here. We've got a fever, flu-like symptoms, muscle ache, headaches. And so often it's misdiagnosed in the beginning, and it takes you a couple of days. Now, how do you actually end up contracting malaria? Well, you contract it through a mosquito biting you. And essentially what happens is the following. A mosquito lays its eggs in water where there is plasmodium living, right, where this malaria protist is. The larvae then grow into adults, and then those adult mosquitoes bite humans. And in the saliva of the mosquito, which they pump into you while they're sucking your blood, and they do that as an anticoagulant, which means so that your blood doesn't thicken, so they can like drink you up like a milkshake. They put that saliva in you, and that's what gives you your itchy bite. And That's how malaria gets inside of you. Once it's inside of you, it goes off and it reproduces in your liver and your red blood cells. It makes those red blood cells burst, which is what ultimately makes you feel so sick and horrible. Now, the only way that you can actually treat malaria is what we call anti-malarial prophylaxis. And anti-malarial prophylaxis basically means you take like tablets before you potentially go to an area where there's malaria. But once you have malaria, you have to treat the symptoms, and you can take prophylaxis, but it doesn't necessarily have the same effect as maybe like another medication like antibiotics. Sometimes you have to wait out the infection. Now, last but not least is our fungal pathogen, and we're going to be looking at ringworm. Now, ringworm is actually, funny enough, misidentified as a worm. It is not a worm, as we will clear up now. It's actually a fungal infection on the skin. So again, let's look at our pathogen pyramid. Looking at the host, it is a human, and it is caused by a fungi called Tinea fungi or Tinea fungi, and we mostly see this in sand or warm, moist areas. In actual fact, this fungi lives on you in very small amounts, but because it lives in such small amounts on the surface of your skin, you often don't have any flare-ups or any irritation. However, what can happen is if it does replicate and there is a lot of it on your skin, you end up getting itchy, red, flaking skin that is inflamed and swollen, and it looks like a red ring. And that red ring is actually fungi growing in the circle. It is not an actual worm, okay? Even though that's what it sounds like in the name, it's not. Now, in terms of contracting it and treatment, you often get contraction via sand and soil, because this is also where the fungi likes to live. And it can also, like I said, just build up on the surface of your skin, because something called keratin, which is a protein on the surface of your skin, which is what the fungi grows off of or lives off of, if you don't wash that away or remove that, or for some reason it builds up and it layers and it layers and it layers, the ringworm loves growing in that. And so it flares it up and makes it itchy and flaky. And that's why we can naturally find actually ringworm growing on your skin, nails, or by your hair and your scalp. The best way to treat it is to keep your skin dry and use antifungal cream. What's also really interesting about ringworm is it can actually go away on its own, and does most of the time. But it's because we start scratching it that we give ourselves a secondary infection, which leads to bacterial infection. Then you've got to get a different kind of medication to treat it. And that's it for today's video on diseases and the pathogens that cause those diseases. If you like this video, don't forget to give it a thumbs up, and remember to be subscribed with your notifications turned on. I suggest that if you are going to be studying this section, you should be going through my grade 11 playlist with all the other videos that match this topic, and then the next topic after this would be immunity. But I'll see you all again soon. Bye!